Good morning, welcome, and thank you for joining the Associated Subcontractors of Massachusetts today for our special conversation with Mayor Marty Walsh. We're delighted the mayor and his staff could join us this morning to give us an update on what's happening in construction in the city of Boston. My name is Mike McDonough. I'm the CEO of ASM. I'm joined today by ASM President Peter Gormley, and we're your hosts this morning. We're joined this morning by over 150 people, most of whom are ASM members, but some are also our industry partners. We thank you all for joining. And please know that ASM is here to help you through this challenging time. If you're not already a member of ASM, I encourage you to reach out. It's during difficult times like these that the association can be of most support for you. We thank you for those who submitted questions in advance. We'll have an opportunity to get to those shortly. And we know that the mayor has a very busy schedule and he'll need to jump off at around 11:30, but we may have a few more minutes after that with the mayor's staff. And now I'd like to ask ASM President Peter Gormley, owner of New England Waterproofing, a subcontractor in Natick, to make some remarks and to introduce the mayor and his staff.
Thanks for joining us today. We have important work in front of us. Today, we have to think of those who've lost their lives, of those suffering loss and fear and pain, and all those who are serving us in our communities in their work, the healthcare workers, first responders, the volunteers, the truckers, the clerks, and of course the trades and so many more. This virus is attacking us as a community, and the only way we can respond effectively is as a community and as an industry. In that, I feel we're fortunate because we are situated in a community and a state which is strong and in an industry that is dedicated, smart, and adaptable. Our association is a good example of that. So today we gather and pool our information, our ideas, our strength, and our perseverance. So let's get started. Here's the mayor and his staff. First up, I have Dion Irish, Commissioner of Inspectional Services for the City of Boston. He's served the City of Boston for 25 years in various leadership positions. We have Patrick Brophy. Chief Brophy is a 24-year veteran of city government and is Mayor Marty Walsh's Chief of Operations for Boston. As Chief of Operations, he oversees public facilities, property management department, and the inspectional services department. We also have Chris Osgood. Chief Osgood serves as Mayor Walsh's Chief of Streets, Transportation, and Sanitation. He works with the Public Works and Transportation departments to deliver exceptional city services, build great streets, and implement a transportation plan that works for everyone. And we have Mayor Marty Walsh. Mayor Walsh is a lifelong champion of working people and a proud product of the city of Boston. He is the city's 54th mayor. Mayor Walsh was sworn in to serve a second term on January 1st, 2018. The mayor's list of accomplishments is long, and we are fortunate to have him as mayor of Boston. In his time as mayor, he has made a number of key issues a priority, including education, innovation in our economy, income inequality, housing, and crime prevention, just to name a few. And we're fortunate to have a mayor who understands construction. Mayor Walsh was a laborer in Local 223 in Boston and rose to head the Building and Construction Trades Council from 2011 to 2013. Mayor Walsh, thank you for being here, and I turn it over to you.
Thank you, Peter. I appreciate that introduction. Thank you, Michael, as well for your great work. I want to it's an honor to be on here. To all the members watching, if you can watch today, thank you very much for what you do here in the city of Boston. We have three great people that work for the city of Boston, Chris Osgood and Pat Brophy and Dion Irish, who worked really hard on a plan on how to reopen construction. As you can see behind Pat Brophy's head, if you're on a Zoom, that we want to add more shovels to that wall for groundbreaking. So we're excited about where we're going here. I just want to give everyone just a quick, a little bit of an update on where we stand right now in the city and the Commonwealth as it relates to COVID-19. Massachusetts has 73,721 cases of COVID-19. 4,552 people have lost their life. When you put Massachusetts ranking in the country, it's the third highest COVID positive cases in the state, and we're the third highest death in the country as well. New York's number one, New Jersey number two, Massachusetts number three. In Boston, we have 10,598 cases of COVID-19, and 486 people have lost their life. These numbers are does not include today. These numbers are up to yesterday. Overall, Boston's average daily cases have leveled off, and there's some indications that we're slowly going down. So that shows that we're moving in the right direction to some degree, but there's still progress to be made with the city, so we can launch a true recovery plan. And I think that that's something that we have to take into account. The only way we get to this point is by focusing on still what I've been talking about: physical distancing, social distancing, washing your face, covering your face, washing your hands, all of that stuff. That's really important. We're also looking at trying to ramp up our testing, where we get to 1,500 tests a day in the city of Boston, where we can get a good benchmark of who might have had COVID and who might not have had COVID. And that bases what our decisions are and how we move forward as reopening society. The way society reopens, it won't be just a flip of the switch and everything goes on. There's a lot of different measures that have to happen. And also there has to be some confidence put back into some of the industry, such as restaurants and entertainment venues and sports and things like that, that people, including you, won't want to come back to right away, because for all intents and purposes, when we do open up, we're going to still be in this situation where COVID is going to be very much front and center, and we're going to be seeing these spikes in different cases, different days. We also built a hospital in Boston, a 1,000-room hospital at the convention center, 500 beds for hospital capacity, 500 beds for homeless capacity. There was also one built in Worcester. There was one built in Western Mass. There's one built down the Cape. The one down the Cape was able to shut theirs down. They've been able to kind of level off the capacity in hospitals. But those are all numbers that we're looking at and how we move forward here in opening up society. But for you on this phone, and I know a lot of you are anxious about what's going on at work. September 27th, all construction sites in Boston, that was the first mandate, must comply with a mandate requiring compliance specific to the COVID plan. Now, with the implementation of COVID safety, the city is expanding categories to allow construction. And some of the key dates, just so you have them. Obviously, May 5th, which was Tuesday, essential construction projects with approved safety plans and signed affidavits will be authorized to prepare for the sites with projects specific to COVID-19 safety measures. May 18th, the city will allow all essential construction projects on the site to meet specific requirements to start their projects. Projects are permitted to have they have to file safety plan and a signed affidavit. Projects sites will be fully prepared to adhere to all aspects of the safety plan, and the work being done for hospitals, school work, residential buildings 1 to 3 units, road, utility, or other open air work such as roofing, steel, erection foundations are on the essential project list. Pat can go into it more for you. The reason why, there's a couple reasons why we put the safety protocol in place. One is to obviously make sure that the workers that return back to work are working in a safe environment. And secondly, if we get a second spike in cases, we're going to be able to monitor and test the workers that we have. We'll have specific places where you can go testing and be able to trace that testing. And Pat can go into that a little bit later, or Chris or Dion, to talk a little bit about exactly why and when that happened, or when and why that happened. The second important date, and that's for everyone else on the call, May 26th, the city will allow all essential construction projects to resume construction activity as long as they comply with the safety plan. This is also an incremental approach that will provide the time necessary to allow large-scale development opportunities to educate the workforce, mobilize safely, or remobilize, I should say safely, and implement safety plans, letting everyone know what's going on. I just want to be clear, we reserve the right to modify or adjust these dates based on public health and safety guidelines. We're not anticipating, at least the first date that I said on the 18th, we're not anticipating right now that we have to change that. But if something were to happen drastically, and this COVID battle is literally a day at a time, something that we are moving forward. We are not permitting any construction that is non-essential under the state order right now, but the state came up with this non-essential and essential order after we shut construction down the city. So I'm assuming that they're going to make adjustments on this as well in the coming days to kind of open up construction as we move forward here. The construction industry is one of the most creative and resourceful industries in Boston. Job safety, worker protection on the work site are always at the forefront of responsible employers. Together, the city, I'm confident with the safety plan that we'll be able to lead the way in the economic recovery. I also want to ask an appeal to you. There are workers that work for you that might not want to come back. My recommendation is you don't force them back, because if they're still concerned about their families, if you have residents or workers that have elderly parents, they're concerned about bringing COVID into the household that could take their elderly parents' life. You have workers over the age of 60 that are at a more vulnerable population. Workers that quite honestly have poor risk or at health risks. They're also vulnerable. So I would ask you that we don't take any kind of retaliation out against any worker that chooses not to come back at this particular time. It's still a very scary time. I'll give you an example. If a restaurant opened today, I don't think you'd find me in a restaurant, just because until all the safety plans in there. And I want to be supportive of restaurants, but we want to make sure that we're taking care of people and moving forward people. So I've heard that a couple of times that people are concerned about that, and would like to ask you to be considerate of that. We also are asking, we partnered with Tufts Medical Center to provide testing services for construction workers. Workers interested in getting tested should reach out to Tufts COVID-19 screening clinic at the Josiah Quincy School, 885 Washington Street in Charlestown. You do not have to be a union contractor to do this. This is open to everyone. And when I talk about construction rules, it's for everybody. I'm not making a difference between union sites and non-union sites, open shop jobs. At this point, every construction worker is the same, and we just need to continue to make sure that we continue to move everyone forward together. So I just want to make a special little disclaimer there. If you have your pens on you, if you want to pre-register, you can call Tufts at 617-636-0019. But we will give you more information as you log on. You don't have to. What I say, I think Pat already sent out a form, and everything is in an email, and we can get you all the information you want. Lastly, I just want to talk real quickly about a topic that's on the mind of everyone, so we can resume all work. Public health is essential to our economic recovery. We are developing a plan to reopen our city in stages. This data is going to tell us what to do. So as you think about building the buildings you're building, or the projects you're building for whether it's residential or it's commercial, we need to have a job. We need to have something in place that those spaces get filled up. So we're working as we move forward here on how do we continue to open up the economy here in the city of Boston. There are a couple of questions. Should I jump into the questions right now?
Yeah.
I have a couple of pre-questions. I'll answer them quick, and then I'll open up. So you want, Michael?
Go ahead.
I'll be fast. What are we doing now? As we respond, which means what are we doing now? As we respond to this crisis, we're planning. There's a lot of planning going on, and a lot of data information being collected, so we can think about what each step will look like, and how we move forward. The one thing we don't want to do is make any mistakes as we reopen the economy. It's something that is really important for us. We're all expecting there'll be a second surge at some point. That's what all the experts are predicting. That second surge would be, the best would be for us to be able to open up business and have precautions in place and precautions and regulations in place that can keep us from having to shut the economy down a second time. That's going to be our goal. That's going to be our intention. My promise is honesty and transparency. When the first cases started to rise, I promised I'd be upfront and transparent about decision making. I know that when I closed the construction industry down, a lot of people were upset with me and mad at me, even some of my friends, and that was fine. They can be mad at me, but I guarantee you, by closing construction now, we actually save lives. So I want to thank you for your patience in that situation. Also, my chief of staff, Catherine Burton, is on the governor's reopening advisory board. So if you have any questions on that, on the reopening, you can get to Michael or Peter and let us know. We can kind of pass along some information to you if you'd like that. Let me think. Let me turn over to you, Michael. You can ask me some questions. There's a whole bunch of things here. Unless you want me to just keep reading.
Yeah, no, thank you, Mr. Mayor. We see what your press conference is, and I think, we applaud you for all of your policies that put safety first, particularly around construction. I think people are just wondering, tell us about your average day for the last 6-7 weeks. What's it like?
My average day is all the same, but very different. I start my day by coming in here. We have an 8 o'clock call every morning. We've done it for the last 8 weeks. It's a crisis response call where we go over what we've done in the previous 24 hours and what we're going to do in the next 24 hours. When we come up with a problem, we come up with a solution within 24 hours and execute that solution. Sometimes it might take a little longer to do that. Just to give you a little magnitude of what we've been able to do, and this is just off the top of my head, in the first couple of weeks after we shut down parades and marathons and businesses, we were able to set up 65 food sites in the city of Boston for our students. We were able to add 8 adult food sites, and we're going to add another 8. So since the beginning of this pandemic, we've served over 750,000 meals to families in need of meals. We're able to distribute over 30,000 Chromebooks to our students in our Boston Public Schools and some charters. We're able to secure Wi-Fi hotspots as well, so we can do online learning for our kids. We're able to build in 5 days. Some of you on this call have been part of it. A hospital in 5 days over at the BCEC, a lot faster than New York did it. And some of the feedback I'm getting is that our hospital is state of the art, even more so than any hospital they've ever seen. So that's a compliment. We're able to secure 1,000 beds for our homeless population for folks that are COVID positive, to isolate, treat medically, and also isolate in shelters, because the way the shelter system is, it's bunk beds and it's together. So we've been able to practice social distancing. 33% of our homeless population have tested positive for COVID-19, which is a large number of 1,800 people tested. So we want to make sure we're doing that. We've been doing robocalls to our seniors every 5 days. We're able to do a citywide lit drop within 2 weeks to a 1.1 million piece of literature that went out in 6 different languages. We've been able to change most of our stuff to 11 languages. And so there's been a lot going on. So my average day is phone call in the morning, 9:30, I'm on a hospital call. 10 o'clock, I'm on a city council call. And I brief the city council. From 10:30 through to about 2 o'clock, I'm in meetings, on a lot of Zoom meetings. I've been talking to associations and different organizations about what this means. And now we're doing a lot of talking about reopening. I generally do either a press conference or a round of press calls every day. And then I have staff meetings throughout the day. So it's a lot of meetings, a lot of phone calls. Not physically fine. Mentally, you get tired of it after a while. And then that's 7 days a week for the most part. This Sunday is Mother's Day, so we're not doing it's our first time, and literally since we started, we're not doing a call. So myself, Dion, Pat, and Chris, we're using the excuse of Mother's Day not to be on the call, and try to stay in, maybe sleep in a little bit, but I have to get up and do a virtual walk, so that's out the window for me. But it's been interesting. The one thing I will say, there's a lot of amazing people in Boston, and I am very grateful for the team that I have around me. They've done amazing work, and this plan that you're getting about the safety plan and the affidavits and all of the things that we're doing was been put together by the 3 gentlemen on this call and some other folks, and they've really had a thoughtful plan. Jim Grossman also was very instrumental in helping us put it together. It's been a lot. There's been a lot going on, but it's been amazing. I've really governed. I've had a chance to govern in this time, and that's something that you don't always get a chance to do every day.
Peter, you want to take a couple?
Thank you. Mayor Walsh, the new protocols that we're seeing place worker safety first, which is as it should be with respect to getting construction restarted. Under this new normal, however, subcontractors are faced with the reality of diminished productivity, increased costs going forward, and in order to work within the guidelines. And do you have any thoughts on how all of the impacted parties can work together to keep our companies strong and keep the jobs going and the region moving forward? Yeah,
I'll give you an example. I know that some of the folks I've heard that I don't like all the protocol we put in place. But let me give you an example. Let's say you're a plumbing contractor and you have 5 plumbers on a crew, and they're on a job where there's no safety protocol. If one of those plumbers tests positive, then the other 4 potentially are on protocol for exposure protocol. So you've just lost 5 workers that can no longer be on the site. If all 5 test positive, then you've lost your workers for 21 days, maybe 28 days, and it could be worse than that. And I think that the protocol really is about not losing productivity, not losing that. I mean, eventually we can hopefully we'll be able to get rid of all of the protocol that we have in place and go back to what we thought of world was like February 1st. But it really is about protecting your workforce and protecting your job and keeping it moving forward. That's ultimately how you have to think of this. This has nothing to do with protocol just for the sake of putting it in. And I think that, we're going to be looking at, in a lot of places, a lot of jobs are going to go to 6 days a week in Boston. Pat can work through that, and Dion will work through that with you, but we're going to be allowing 6-day shifts. You might want to think about shifting work as well on this as you move forward. And I know that in talking with the trades, on the trade side of it, a lot of the members at first were upset about that we shut construction down. And then when they realized the magnitude and the seriousness of COVID-19, they realized that it was the right thing to do. Now, as we reopen, it is going to be about how do we make sure productivity stays forward, because I've heard concerns from banks and owners, project owners, that they're concerned about productivity as well. And I am too. I want to see these products delivered on time. We have a school that in Boston Arts Academy, that we wanted open by September of next year. It's probably not going to hit that timeline. So now we have to prepare for a mid-year move-in. And we're an owner in that project. A lot of these jobs that the subcontractors are working on, we're the owner on them. And just like an owner of a private development, I want it done on time. I want it done under budget. I want it done faster. And as best we can get that. So that's a big concern of all of us.
Thank you. Another kind of nuts and bolts question. In the beginning of the crisis, we as an association and many of our members donated our supplies of PPE to local hospitals or other first responders and such. And we're having trouble securing enough PPE like everybody else. And in the meantime, ASM is trying to be a resource to help members find places to get PPE. When do you think manufacturing might start to catch up? What's your sense of that?
I have a meeting with the governor today, and that's one of the topics that I want to bring up with him. As we think about this, as we think about reopening Boston and industry, every single industry and every single company is going to be looking for masks, and in some cases gloves. And I'm going to have a conversation with him today. The industry is not caught up with the demand yet. So the supply, as I should say, the supply is not caught up with the demand yet. And I don't have an answer for you on that question at this particular moment. I would love, we should check in a week or so and see if we have other answers. But we're chasing every single lead down to try and get the proper PPE, even just for a different industry here in the city of Boston. And that's going to be a concern. So I think some of it is we do have guidelines on making your own masks and bandanas and things like that. So I think at least for some workers and some jobs, that might be the suggestion in the very beginning. Until we get further. I don't know, Pat, maybe you can jump in that one a little more.
I'm sorry, Mayor. Yeah, obviously we want to make sure that we can ensure that everybody has the proper PPE. We're going to be working with people to make sure that the industry adopts as much like common sense practice as possible. So the acquisition of that stuff, we do recognize as being part of a challenge, and that's why we're trying to give people as much time to ramp up. We know that getting sites squared away and getting those things, implementing the signage and implementing the controls and the walking through the site, making sure that they have enough PPE, and we're hoping that a lot of the subs can bring in their own stuff and abide by the GC's overarching safety plan.
And also, just on the mask, one thing I would do is just make sure that if somebody puts a covering on their face, you want to make sure for your own workforce to make sure it's accurate. We have public health experts that can check, and ISD commissioners that will know. Like some people put like a thin layer of cloth over their face. That's not accurate enough, so not efficient enough, so effective enough. So if we can be helpful with that, that'd be great.
Thank you, Mike.
Thank you, Peter. Mr. Mayor, there's been some different ideas about what's considered essential in terms of construction over the last few weeks. And can you just tell us a little bit about maybe conversations with the Baker administration, maybe some of your conversations with other cities such as Worcester or Springfield, Somerville, Lawrence? Like, what are some of the key things that you've taken away, some lessons that you've learned?
Well, first and foremost, like I said, today I'm going to have a conversation with the governor, and There's a lot of on the non-essential construction that I think that if we're going to open the industry, when I shut construction down, I didn't come up with an essential, non-essential list other than emergency work. And I felt that all construction should have been shut down. I think now that we're thinking about reopening it, and our plan is a very solid, thorough plan that I think the state's adopting a lot of our regulation and guidelines. I think that he'll have to make an amendment to his non-essential, essential construction list, and hopefully by next week that will be made. I think that a lot of our information, we've passed it out to mostly Eastern Massachusetts cities and towns, such as Somerville and Cambridge and Malden and Medford and Chelsea and Quincy and things like Quincy never shut down. So we did send that information out to them to help them with a timeline how we move forward. I have not had conversations with Worcester or Springfield per se about the construction guidelines and about what they're doing. I'm not even sure what's going on out in those areas, to be honest with you. And I can look into that for you, Michael, to see how we do it. But I think that I think when we think about construction, you're going to be kind of the first real full industry going back to work, and there's going to be a lot of best practices taken out of the industry. I know the construction workers think differently than office workers, but when it comes to COVID-19, the thought process is pretty much the same when we're talking about protecting our workers, testing our workers, tracing our workers, all of that. It's all the same premise. We did have a conversation with the state as well about the MBTA, because that's a concern. It might not have come up in questions, but we're working to try and make sure that there's a sufficient enough capacity on the MBTA to be able to get workers in and out of town. A lot of our workers don't live in Boston. They live outside of Boston. A lot of your workers in this call don't live in Boston, live outside of Boston, but they work in Boston. So we're working to make sure the capacity is there.
Great. Just to follow up on that point, as construction does start to reopen, we see different construction safety plans from different GCs and maybe some different requirements from cities and towns. I mean, do you see a point where we get to some consistency where there's a uniform adopted plan that most sites could adopt, knowing that each job is different and it's going to need to have some different elements based upon the job site?
Yeah, I think a lot of people are basing their framework off of our policy or the state's policy, and the state's policy was adopted to some degree off of our policy. We worked collectively together on it. So I think that the best we can line up the city of Boston's policy and the state's policy with the protocol is probably the best model to use. And we can encourage, I'll talk to the governor today about encouraging other cities and towns. I don't know if anyone else has anything to add on that one, on my team.
No, you're 100% correct, Mayor. That was a plan that was set up and lined up with a consultation of the state guidelines and the best practices in the industry. We do recognize that we have a lot of talent. We haven't stopped working at any of the inspectional services. Any of the inspectors, they've been going on since the start of this crisis. But we have been consulting everyone there, and we think that we're a little bit further ahead, but we've been sharing the best practices with our neighboring communities. So there is some continuity in terms of how that gets squared away. But we are definitely, given the size and nature of our workforce, we've been able to be a little bit further ahead than some of our neighboring cities and towns. But yes, we have been sharing it, and we hope that people adopt it as best practices.
Okay.
Michael, there was a list of, and Peter, there was a list of questions that were sent in to us. I know we didn't hit them all, but what we can do is we'll get you an answer and get it to you so you can send it out to the members, because I'm sure some members have some questions that we didn't answer. So we'll make sure that we'll respond to all these questions in writing. I have them here on my screen. We'll get them to you, and you can pass it out to the members so they have their question answered.
Very good. Thank you. Mr. Mayor, are you departing now?
Yeah, I have to run off. I have a line outside my door here, social distance, 6 feet apart, and there's something going on, so I have to see what's going on here. And there's one guy out there. I don't know where he came from. He looks like he's my former fire commissioner. I think he's retired. He has a beard now, so I don't quite understand that, but we'll have to talk to him about it.
All right. Well, thank you, Mr. Mayor, Chief Brody, Chief Osgood, and Commissioner Irish. It's so helpful to have this kind of direct communication and dialogue. We look forward to working with you to open up construction safely and bring back the much needed jobs and projects. The pandemic's got such broad effects and are so extreme. We have to work together. each with our own contributions. And the tradespeople, please, all of you out there, be extra careful. We need you in our communities. We need you at our jobs, and we need you healthy and with your much needed skills and energy. We want to take care of you. Let's all find ways to make this happen and get the job done. One last plug for the Associated Subcontractors of Massachusetts. Come join us, become part of the solution. We want to work together as an industry and all of our industry partners to make this work. And we really appreciate, Mr. Mayor, you being here and helping us to kind of kick that off. All of you out there, come work with us. We can make this happen the right way. Thank you.
Thank you, Peter, and thank you, Michael, and to all the subcontractors on the phone. Thank you as well. I know that you do a lot of pro bono work and you do a lot of great stuff during difficult times and all the time. So I just want to thank you for what you do, not just as contractors employing people, but as individuals supporting organizations. Appreciate it.
Thank you, Mr. Mayor.
Thank you.
Thank you, Mr. Mayor.
Bye, Michael.
Bye.